Hello, everyone. I am Saiba Manyar, your Program General Assistant for this term. And I welcome you to the first ever webinar of this program's week. With this, we begin with the basic question that you may all have. What are IFMSA programs and what are the IFMSA programs team? IFMSA program is an umbrella body which affiliates activities, which records your impact, and also networks activity coordinators globally to create a greater impact of IFMSA every single year. The programs team is the team which works to ensure the affiliation and the reporting is done on a cyclical basis and a regular basis, suggesting you the best possible outcomes of your activities. So we begin our webinar today with three very, very lovely program coordinators, out of which two are here today, Elias and Natella. We begin our activity enrollment, activity management, and IFMSA enrollment webinar. Could we go to the next slide, please? So a very basic question that we all may ask, what exactly is an activity? Although it's a very subjective topic and a very subjective thought to each one of us, IFMSA defines activity to be a unique set of planned interventions designed and implemented to achieve certain specific objectives within a budget and a specified period of time. And hence, it is very important to have a very well-defined cycle of activity management to ensure you achieve all your goals, all your objectives, and maximum impact by the end of your activity. Could we go to the next slide, please? A very important question and a very confusing question that we all get is, what are the types of activities? Number one, a capacity building. I think this is the most common type of activity that we conduct globally, especially since COVID-19 has taken over. Capacity building is a workshop or a training that we conduct for a group of students or a group of people to increase their skills or knowledge on a particular area. The second very common type of an activity is an education type of an activity. Education is obviously spreading awareness on a particular health issue or increasing the knowledge on a particular health issue in societal populations. And another very important thing that we've noticed is there is a very fine difference between capacity building and education. And activity coordinators often forget that fine line. So capacity building is when you go to medical students to capacitate them or to increase their skills or knowledge. And education is when you go to the society or to a general population or to a different set of populations to increase their knowledge or awareness in particular issues. Next, we go to is advocacy. Advocacy is when you're trying to influence your stakeholders or when you're trying to bring out a change on a governmental level or on policy level. That is something that is known as advocacy. And campaign is a simple mix of advocacy and education. When you try to bring out an activity in which you're also trying to bring awareness, but you're also trying to influence your stakeholders, it becomes a campaign. Research. Unfortunately, it's not a very well explored section of activities, but we really wish we get more enrollments in the field of research. Obviously, research is identifying the cause of issues and also understanding its impact after the activity. So we really request you, if you have any issues with research, please do enroll them in that field as well. And lastly, the most rare kind of an activity is a third-party activity, which you do in collaboration with a third party or an NGO or a government or a university, an external per se. Can you go to the next slide, please? When you begin, what is the first thing that you think about? Who do you approach and who are you benefiting? This is when you come to the question of target audience and beneficiaries. Target audience are your group of people who you are going to address to. Beneficiaries are a group of people who are going to benefit from your activity. For example, when you are conducting an activity on rights of women, women become your target audience, but your beneficiaries become women, become their children, become the general population, and also become their husbands who are going to benefit from the progress that they are going to make in their life. And that is the fine line between target audience and beneficiaries. Could we go to the next slide, please? Like I mentioned, when you are planning an activity, it is very important to evaluate your risks and benefits, to have a very clear idea on what are you going to present, on what are you going to plan, how are you going to monitor it, how are you going to progress it, how are you going to deal with the crisis when it comes to it, for which you will have to refer to our workshop later. But a basic idea would be, you need to have a basic vision, a clear vision on what is that you want to address with your activity. After that, you discuss about defining the results, and you think about what is your expected outcome. You then go to your planning of monitoring your activity and planning of evaluation of your activity. How are you going to monitor its developments? How are you going to evaluate its progress? How are you going to measure its impact? And then you try to implement everything that you have thought about. So you implement it, assessing the risks and benefits, understanding what is it and how are you going to assess it. And lastly, you manage it. You conduct your crisis management. You try to evaluate its progress, and finally you culminate your activity, hoping that you achieve your outcomes. Could we go to the next slide, please? And hence, in the planning stage, it is very important to first understand the cause of a problem. Secondly, understand the main problem that you have. And thirdly, understand its consequences. It's nothing better than a tree. Your roots become the cause of an issue. Your main problem is the bark, which is what you get to see. And consequences, or the impact, is the beautiful kind of the foliage that you get to see after your activity has been presented. Could you go to the next slide, please? And hence we discuss the problem tree. Further on, we would be discussing the objective tree, stakeholder analysis, the goals, objectives, and success indicators. And now I think I hand it over to Elias. Thank you so much for sharing your screen until now.
Thank you, Saiba, for what you showed us in the previous slides. So now we're going to talk about the vision, goals, objectives, starting with the vision. A vision is an idealistic statement describing an ideal future that you desire. It can be considered as an attempting to imagine a future, which is exactly what we hope for by doing the activity. It is like taking a screenshot of the future that we're going in. So it is what we see. It is important for the vision to be somehow absolute. What do I mean by that? Like you can see in this example, we can say that a world in which everyone has access to mental health care, or a world in which no child ever gets cavities. Why do we use a word in which? Because it is simple and it shows us what the future is leading us to. A common problem that we can get into when formulating the vision is when we say a word with more access to mental health. This lacks a little bit of absoluteness, and the vision needs to be absolute and idealistic. So this formulation can be a better way to make a good vision that can help you then write your goals and objectives. Okay. So now, before moving to the vision and goals, before moving to the goals and objectives, I want to explain you a small model, which is the mountain model. In this model, you can say that we want to reach the summit of the mountain. So the main issue in here is that the mountain itself. So in order to get to the top, we need to go through many steps. Here would be obviously getting to the top of the mountain. So that's why we drew a line here. Then how are we going to do it is by the goals and objectives. So the part of getting to the top of the mountain represents our goals and objectives that we're going to see how we can formulate them, and what are we going to use to get to the top are the methods. Also, that we're going to discuss them later. Okay, so moving to the goals are the workhorse of activity management. Without goals, we won't be able to clearly establish our objectives. So we will have trouble organizing our activity. So since goals are elements which describe a change, most changes can be described starting with increase and decrease. Again, we can use other formulations, but these can show why we're making a change. So increase and decrease are really like great formulations to show that you're making a change by doing this activity. Some examples, like for example, in mental health, you can increase access to mental health care. You can increase knowledge about vectors of contagion of influenza, and you can decrease deaths due to malnutrition. These are solid goals that you can use in our activities. Okay, so moving to the second part of how are we getting to the mountain, which are the objectives. The objectives needs to be smart. What do we mean by smart? Specific, measurable, achievable, relevant, and time-bound. Specific, we need a specific target group, a specific topic, and etc. Measurable would be how many people do we want to reach, how many articles do we want to post or submit, and how many words in those articles. So it's more about measuring what we're doing, having concrete numbers that will lead us to reach our success. What do we mean by achievable? Achievable means, or attainable in some cases, it is possible to do this activity within this time frame. So depending on what we are doing, we should set clear, achievable objectives that really are kind of realistic and relevant, which is sometimes confused with realistic, needs to show that our activity is really relevant to the issue that we're addressing. So for example, if we're having an activity about increasing mental health access, we won't do a screening for diabetes, which can be related in some way, but it is not relevant so much. So, and the last part is the time bound. Time bound means that by when do we want to achieve the set of objectives? And it is really important. Okay, so to get back to the mountain model, as you can see, the goals and objectives are how are we getting to the top of the mountain. I'll give you an example. Like for example, we can get to the top of the mountain with using a parachute out of a plane. We can use a helicopter. We can climb. And so we need some set of steps, which are the goals and objectives that will help us to do that. Okay. Moving now to the last part, which is the success indicators. They are so important as they provide a basis for monitoring and evaluation. So they are intended to indicate the extent to which objectives have been met or achieved. They should indicate a concrete ambition level, like a certain percentage of or a number, and not just more and increased. So this really needs to show a baseline number that show how are we going to achieve and meet our objectives. So every objective needs to have a success indicators. For example, if we set an objective of 100 medical students are able to define mental health in 1 hour online session, the success indicator can be 80% of these medical students were in fact able to define mental health in 1 hour online session. So I really want to stress that when enrolling your activities, try to make at least one success indicator by objective, and it should be really specific to that objective and measurable, and containing a baseline indicator like a number or a percentage. Now I leave the floor to Nutella to explain the next part.
Okay, thank you. Hello, everyone. I am Nutella, the program coordinator for health systems. So can you move on to the next slide? Okay. So we're going to be talking about problem statements. First of all, it's we're going to talk about the things that I'm going to talk about. We're going to tackle them from a point of view of like activities and proposals, and then from the context of enrollments. When it comes to problem statement, it's basically the why or the reasoning behind you doing a particular activity or a project or carrying out a particular effort. So when it comes to the enrollment context, we need like a few things just to understand why are you putting so many resources, so much time, so much effort into a certain activity. First of all, we need to know what the problem is. You need to pinpoint it. Like, for example, there is a certain outbreak in your country, or there is a insufficient amount of money being allocated to mental health services, or there is a lack in the awareness when it comes to the risk factors of non-communicable diseases. You need to define exactly what your problem is. Then you need to define who has that particular problem. Is it the general population? Is it medical students alone? Is it women? Is it, you need to have like a certain group of people who this problem is affecting. Then you need to define where the problem occurs. Is it happening on a local basis, in your neighborhood, in your state, on a global level, in your country alone, on a couple of countries? You need to define the place where the problem occurs so that we can understand the extent to which your activity plans to impact that particular problem. Then you need to define when is it occurring. Is it happening right now? Has it been happening for 2, 3, 5, 10, 11, a million years? Is it going to continue on for like a solid amount of time? You need to define like, when has it started? Is it continuing now? Has it stopped in the past? Is it going to continue in the future? You need to define like a particular time frame of when this problem is occurring. Then you need to mention how the problem affects the community or impacts the community. We talked in the second point about who has the problem, but in this point, you need to define how that problem affects that particular group and the community around it. Is it causing them lack of access to healthcare? Is it causing them distress in their life? Is it affecting their socioeconomic status? You need to define a clear link between how the problem impacts the community and the problem itself. When it comes to the problem statement, you need to be concise, specific, and measurable, which means usually we need for people to mention the problem clearly, provide a couple of statistics just to make sure that this is an actual problem, and be very, very specific in what they write, like not going on and on about details which are not particularly important, or they shouldn't be like mentioned for us to understand the importance of this problem and its impact on the community. Can we move on to the next slide? So we're going to talk about the methodology, which is something that has been touched upon. Usually when activity coordinators or people who are carrying out activities come to the enrollment form, they presume the methodology is just mentioning if this activity is a campaign, or is it a workshop, or is it whatever, which is kind of true, but not the entire extent. When it comes to methodology, we need to know what exactly are you doing, which is, we need details. We need to know when are you going to initiate the activity? When are you going to open a call for an organizing committee? Is there an organizing committee? Who is involved with that particular activity? What type of resources are you going to use? Are you going to conduct a campaign? Are you going to have a workshop? Are you going to have several workshops? Are you going to carry out sessions? We need details, and those details need to be put in a clear sequence, in a step-by-step action form, so that we can really see if your activity is hitting all the objectives, hitting all the targets that it's set out to do. And then you need to highlight the major events. Usually those are the campaigns, the conferences, the panels, all those things that are, you know, the major part of your activity. Then you need to have a clear timeline, which is something that a lot of people fail to do, is like just write when this particular action is going to take place. Is it going to take place, for example, next month, next week, tomorrow, after a year? You need to have a clear timeline in order for us to see how long is this activity going, and is each action taking place affected by the one coming after it. Then we need to know what resources are you using. This includes human resources, money, logistics, all those things. And then a brief description about the teams and organizing committees that are involved in the activity or project would be nice. This is not particularly very important, but it would be nice to have it in the methodology, just to know the number of people who are involved in the planning and execution of this activity. Next slide, please. Here we're going to talk about collaboration and funding. We're not going to go into so many details about it because they are such broad topics. We do have the IFMSA fundraising manual, which is an amazing reference point if you want to learn more about collaboration and funding. But basically, when it comes to activities, we want to know, who are you collaborating with? Are there particular stakeholders who are interested in supporting your activity or sponsoring your activity? And then what is the nature of this collaboration? Are you providing them with human resources? Are they providing you with money? Are they providing you with logistics? Are they providing you with materials or resources or inputs? We need to know who is like the entity that you are collaborating with, what you are providing them in this collaboration, and what they are providing you when it comes to this collaboration. Then how are you going to benefit from it? This we need to know so that we can understand the true reason behind the collaboration. Are you gaining money? Are you gaining promotion for your activity? Are you gaining access to, let's say, political stakeholders? Are you getting logistics? Are you getting outreach to places that you couldn't reach on your own? We need to define the exact benefit that's coming to the organizing committee or the people who are carrying out the activity from the particular person who are they collaborating with. And the last and most important part for us when it comes to this collaboration and funding point, we need to know, are these collaborators, sponsors, or any person who is giving you any kind of resource eligible in terms of IFMSA? We have an ethical fundraising framework, which you can look over to see the type of stakeholders and the type of collaborators which are eligible in terms of IFMSA. Next slide, please. So the last point that I'm going to be talking about is evaluation. I'm not going to go into so many details about it because we have a webinar, an upcoming webinar about evaluation and reporting, which you should definitely check out. So when it comes to evaluation, Elias mentioned the indicators of success, which is basically the thing that you do before the activity happens so that you can ensure that your activity is met and the objectives of your activity are met. But the evaluation process is actually checking and taking actions to know if those success indicators and those objectives were met or not. So when it comes to evaluation, you need to think of like a couple of questions. First of all, does a post-activity evaluation even exist? Which means after your activity is over, are you going to conduct an evaluation of all the indicators of success, all the things that took place, all the processes or the actions that have been included in the activity? Are they going to be evaluated or no? Then we're going to see if there is a pre-activity assessment. This is something that a lot of people fail to do, or not fail to do, they overlook it because I don't know why particularly, but not a lot of people do a pre-assessment or assess their objectives and their status before the activity actually starts. But it's a really, really important part in the evaluation process because it gives you like a base ground and a kind of data that you can refer to when you are conducting your post-activity evaluation. And then you need to think, are you going to have plans for monitoring throughout the activity? Usually people also tend to have evaluation just at the end of the activity. There aren't no consistent monitoring processes taking place throughout the activity, which basically means that you are conducting an evaluation before the activity is over, just to make sure that everything is going on track, the objectives are being met, resources are not getting wasted, and all that. Then do your evaluation plans cover all the goals and objectives? Again, this is something that a lot of people suffer with, is that they set an overall or a generalized evaluation plan, but when it comes to the actual part of the evaluation and carrying out that plan, they find out that some of the objectives were left out and they aren't exactly measurable or evaluatable. So when you are setting your evaluation plan, you need to take into consideration all the objectives that you have put and all the indicators of success that you have put. Are they going to be measured? How are you going to measure them? Are you going to collect data through questionnaires, through Google Forms, through interviews, through pictures, all those things? And then you need to define your nature of evaluation. Is it quantitative or qualitative? We're going to talk a little bit more about that in the upcoming slide, but also a huge reference point for us when it comes to evaluation is the IFMSA evaluation manual. It's an amazing document that covers literally evaluation from beginning to end. So if you want to know more details about how you can carry out a very proper and a very successful evaluation, you can refer to that. Next slide, please. So when it comes to the quantitative versus qualitative evaluation, it's basically just in the quantitative one, we're talking about numbers. The data is collected through strictly numbers. You are using statistical modalities like arithmetic means and standard deviations and all that. But when it comes to qualitative evaluation, usually your evaluation data is collected through something qualitative. Usually that's interviews, open-ended questions, close-ended questions, pictures, all those kind of things that don't necessarily or are not considered numbers. They are qualified as a qualitative evaluation. And you need to know this before you start your evaluation process or before you even start your activity, so that when you come to the evaluation process and the analysis of the data that you collected, you would know how to analyze it. Most people assume that the data collection for the evaluation is the complete process of evaluation, but no, you have to take the data that you collected and actually analyze it and produce certain outcomes. And if you don't know if you have quantitative or qualitative evaluation, you won't be able to do that properly. Lastly, the importance of evaluation and why we talk so much about it and why we have like an entire webinar coming up about it is that we need it for the program's annual impact report, which is something that basically showcases all the impacts and effort carried out by activities under the umbrella of IFMSA programs and how many people we reach, what are the changes that we made when it comes to the objectives of the programs and all that. So yeah, I guess right now we are going to go to Sahiba again.
So I think we would summarize the entire, thank you so much, Natella. I think we would summarize the entire activity management cycle with Rania. Rania, could you please present your screen?
Yes, can you hear me?
Yes, we can.
Okay, perfect. I'm presenting the screen right now. Can you see it?
Yes, great.
Okay, great. Okay, so we've talked brief but the previous people have already focused on the different parts of the activity cycle, and I will just like to sum it up. So whenever we're going to have an activity, the first thing is to determine the problem. And to do that, we can use the problem tree. The tree helps us determine not just the apparent causes, but also the causes that are deeply seated for that particular problem. It also helps us to understand the consequences of the problem. So using the problem tree, we can also determine the objectives and the particular success indicators that we can have. And this helps us streamline our activity further. So as you already know, the project goes through three cycles. The first part is the planning. So once we have the problem and the objectives marked out, we can now decide on the stakeholders. So stakeholders are anyone who is involved in the process, who is influenced by the activity and who will be influencing the activity. And for us, we need to understand exactly where the stakeholders are. So to do this, we use the stakeholder mapping technique, where we map them out based on their power, that is the influence they have over the activity and their interest within the activity. And it helps us to develop the strategy on how how to approach them, whether or not we need to keep them informed or whether or not we need to manage them closely. It also helps us understand who will be our allies and who are neutrals and who will be the opponents. So once we are done with the planning, it's time for implementation and monitoring. As you may already know, monitoring is a continuous process. We don't do it just at the end, we do it throughout the activity. So for starters, we can have a project overview by using the storyboard technique, which helps us to visualize the entire event, all the tasks that we have to do, each little step, it helps you plan that out. Then the second thing we need to do is the division of labor, and using a task sheet really helps in this case, where everyone knows which person is responsible for which task and what is the priority of that task and whether or not it is completed or it needs to be completed. And finally, time management is of essence, and we can use a Gantt chart to visualize exactly how much time we need to allocate for each and every part of the task. So following planning and monitoring, what's left is evaluation. And Natala just already gave you a very detailed overview of how to carry that out and why it is important. Finally, I would like to say that if at any point you need further help regarding the activity cycle, please do refer to the Ideas to impACT manual that we have. Thank you very much. I believe now, Sahiba, it's your turn.
Hi, I'm sorry. Elias, could you please share the screen for me? Great. Okay, so one thing, when you design an activity, you intend to make a difference locally. Every single day, innumerable members of IFMSA work at local levels to resonate with the ideas of IFMSA globally. But how would I know, sitting in India, what kind of an impact Iran is making, or what kind of an impact Mexico is making? A very simple way of doing it is letting IFMSA know what exactly you're doing. And how do you do that? You do that by a simple step called enrollment. So what is enrollment that we always talk about? Enrollment is the process of affiliating your activities with IFMSA. It is just, to keep it very simple, it's just a very simple way of letting IFMSA know how are you going to, what kind of activities you've done, what is the activity management you've used, what are the methodologies you've used. It allows you to be a part of the activity database and join the network of activity coordinators globally. What exactly can you enroll? In the start, we spoke about something called activities. What exactly are these activities? So these activities could be your projects. They could be webinars or your capacity building trainings or workshops. They could be conferences, and they could be campaigns, like we mentioned, education and advocacy activities together. So could we go to the next slide, please? So what are the steps of enrollment? Enrollment, unfortunately, is considered to be a very strenuous procedure. But as the programs team, we suggest you to start with project design. We suggest you to start with planning, monitoring, and evaluation of your activities. And after that, your enrollment is just going to be a maximum 5-minute job. It's a very simple 3-step procedure. The step 1 is going through your focus areas. There are 13 programs in IFMSA. Out of that, each of these programs have innumerable focus areas. Where does your activity actually belong? So in fact, we have a focus area sheet. We have a Google document. You could go through it and decide where exactly does your activity fit. And once you've decided that, you could either contact your program coordinator to confirm it, or you could simply enroll the activity and wait for your program coordinator's response. The next step is fill up the enrollment form. And it's a very simple Google form. And once you have made your basic activity management or your basic project design and you have it ready, you just have to copy paste whatever you have in this document and send it to your program coordinator. But you also have step 3, which is attachment of a candidature form, which has to be signed from your president to get a confirmation of NMO support. So to summarize it, IFMSA enrollments into programs has just 3 procedures. 1, decide your focus areas. 2, fill in the enrollment Google form. And 3, attach the candidature form signed by your president into the enrollment form. Could we go to the next slide, please? When can you exactly enroll? One question that we are asked all the time. So the answer to this is very, very simple. You can enroll an activity literally whenever you want. But the best time to enroll an activity is before you plan it, so that your program coordinators could help you with resources. They could help you with planning, monitoring, suggestions with evaluation. They could help you get maximum impact from all your methodologies and all your objectives. They could help you with your success indicators. They could help you plan your whole project design too. Additionally, you could also have the program coordinators help you with the content and with the resources. Also, they could help you have network and collaborate with like-minded people. So all of this could happen only if you enroll your activity or you contact your program coordinator before you are implementing your activity, or mainly in its planning stage. Could we go to the next slide, please? Who can enroll an activity? You, I, every single person, any general member from a full candidate or associate NMO of IFMSA could enroll an activity. The only thing that you need is your candidature form to be signed by your president to showcase your NMO support, and there you can enroll your activity. The people who design, monitor, plan, evaluate the activities, these people are known as activity coordinators. And these are the people of our interest who are global enthusiasts of change. And so maximum number of people that we allow in one activity enrollment is 2. So a total of 2 people can enroll an activity. But what if there are more than that? So of course, the 2 with maximum kind of influence could enroll an activity. What if it's an inter-NMO collaboration? What if there are 2 NMOs who are working together on it? No, both the activity coordinators have to be from the same NMO. So if it is an inter-NMO collaboration, there has to be some kind of consensus that you reach. Sometimes people suggest the person who initiated the collaboration enrolls the activity. Sometimes the NMO which does more contribution enrolls the activity. So the decision is totally upon the 2 NMOs or the activity coordinators who are coordinating the activity. But we need a maximum of 2 activity coordinators who need to be of the same NMO. Yes, if you are doing a collaborative activity, your NMO name does go on the candidature form and does go on the enrollment form too. You are documented as well, but the activity coordinators would belong to the 2 activity coordinators whose president has signed the candidature form. If you have any doubts with this, I request you to please contact me or contact any of your program coordinators for more details. Could we go to the next slide, please? So levels of activities. In IFMSA, we have activities conducted at multiple levels every single day. It starts with a local level. And personally, according to me, I feel these are the most impactful kind of activities, because these are the activities we're going to our general population, to our local public, and we're trying to bring a change on the local kind of population. So local activities are conducted by local officers at a local level, at any one local council. A national activity is conducted by 1, 2 or more LCs. It is when it becomes a national activity, mostly designed by your NOs or national officers. Or when it is conducted with people across LCs, it becomes a national activity. For a regional activity, when an activity is conducted by 2 NMOs in the same region, for example, if India and Pakistan are doing an activity, it becomes a regional activity. And an international activity is when 2 NMOs are belonging to 2 different regions. For example, if India and Egypt are doing an activity, it becomes an international collaborative activity. Could we go to the next slide, please? A general layout of activities. Number 1, a first-time activity. Most of the activities that we enroll are generally first-time activities. These are the activities that are conducted for the first time. They are implemented for the first time. They are planned for the first time. So these are mostly activities which are not sustainable, but definitely have scope to be very, very sustainable. Number two is a replicating activity. A replicating activity is, according to me, the most beautiful concept of IFMSA, and I think it's the main purpose of IFMSA programs. Replicating activity is when an NMO seeks inspiration from another NMO's activity and conducts it on ground. For example, if I see an activity that is conducted by Turkey and I really find it very inspiring, I am going through a similar problem in my NMO. I want to conduct it again. I conduct it as in the form of a replicating activity. Over these years, a very, very common replicating activity that we have seen is the teddy bear hospital that is in the program of EHRH. It is a replicating activity which is conducted globally. And in fact, it is so commonly done that it has become a focus area currently. Thirdly, and the best kind of enrollments are continuous activity enrollments. These are sustainable activities. These are activities that were conducted previously. They were enrolled maybe previously as a first-time activity. And now, since they are done again, they are enrolled as a continuous activity. These are the activities which ensure maximum sustainability. These give maximum impact. And hence, personally, I highly suggest you to have a lot of continuous activities. I suggest you to plan activities in a way that you have a long-term goal, you have a long-term plan with your activity of making it a continuous activity to get a big impact in the long run. Could we go to the next slide, please? Yes. And why must you enroll your activity? A very, very commonly asked question, and something which even I did not understand the purpose of. Why should I go through? IFMSA gets to understand what are we doing locally and what are we doing nationally, what are we doing regionally. But what are you going to gain with every enrollment that you do? So one, you get support from program coordinators. Program coordinators would help you to design an activity, to develop it, evaluate it, monitor it. They would also help assess the impact, and you become a part of IFMSA's program annual impact report. So you actually become a part of, you are eligible rather to become a part of program impact report of IFMSA. You also get additional benefits such as, relevant resources or contents of the matter. A lot of times, program coordinators also enhance the skills of activity coordinators by taking webinars of the volunteers or by, capacitating them in their way. And they also help you with the whole enrollment procedure. Next, you are eligible for a lot of IFMSA opportunities. Have you ever thought about, winning an activities fair or winning a Rex Crossley awards or, winning the memo grant? Or any of these. These are those, gold medal awards of IFMSA, which credit you for the kind of impact you're making and the kind of contribution you're making to the goals and visions of IFMSA. And the most beautiful part about it is you encourage other people and you inspire other people to conduct similar activities in their country, in their NMO or wherever they are. So if you enroll for these, if you enroll in IFMSA programs, you become a part of, you become eligible to, apply in activities fair or the Rex Crossley. And hence that's why we get a lot of enrollments in January. So you also get something called an international recognition. And what exactly does the international recognition come with? Number one, your activity is officially registered with IFMSA. So yes, you get to use the IFMSA logo. You also get support at local, national, regional authorities. Once you have the IFMSA certification or you have the IFMSA certificate of enrollment, it is very easy to get grants. It is very easy to get collaborations from NMO, from universities, from governments. In other words, it's very easy. It's easier to approach your stakeholders when you have some kind of a backing from IFMSA, which comes from enrollment. Additionally, it helps you to create a network. It helps you to create a network with other activity coordinators globally. So when you are working on a document, when you're working on an activity, you are able to collaborate with someone from a totally different region and definitely understand the issues they are going through, contribute globally. And I think that is the whole purpose of IFMSA, where we are working locally to make a difference globally. So it also helps to increase your impact of the activity, because the program coordinator not only helps you, but also you're joining forces with other NMOs who are suggesting you changes. Additional to that, you're also seeking inspiration, and you're also giving inspiration to other people about the kind of activity you did. I think when someone from a different NMO looks at your activity and gets inspired by the work you do, that is the most beautiful thing for an activity coordinator, apart from a huge impact that he creates. So could we go to the next slide, please? These After the whole webinar, we thought it would be very important to discuss a few very frequently asked questions to our program coordinators. So number one, what if the name of your activity is in a local language? Either you can enroll it right away, but what we suggest to you is you convert it in an English word and you enroll it in that way. Second one, what if you want to enroll an activity in multiple programs? My personal suggestion, don't do it. But in case you still want to, you can enroll it in a maximum of 2 programs. Consider a situation where you have one activity which has 3 sessions. One which is focusing on gender-based violence, one which is focusing on medical education, and one which is focusing on public health. And all of this could be on maybe adolescent health. So what would you do? You could either enroll all 3 of them as individual sessions or individual activities, or choose your 2 most prominent focus areas and enroll it in two of those programs. However, under no circumstances does the program team allow enrollment into 3 different programs. So please keep that in mind. Either you can enroll it as 3 different sessions, or as many number of sessions as 3 different activities, or simply you choose your 2 most prominent focus areas and enroll it in that way. The next one, how long does it take for the enrollment process? So most commonly, your enrollment process, our program coordinators refer to the enrollment sheet every 10 days. So within 10 days or within the next 15 days, your enrollment should be done. But sometimes definitely it takes more time. You will be contacted by a program coordinator by mail or by WhatsApp to understand certain amount of changes. So it is very important to keep in contact with your program coordinator throughout the process of enrollment. The next one, corrections suggested by the PCs. It's a very enrollment is a very subjective thing. Sometimes some PCs may have a certain criteria of enrollment, and hence he or she may suggest to you some corrections. That really does not mean your activity does not make it to the enrollment cut. That really does not mean your activity is not impactful enough. That also does not mean that your activity is not going to make a great impact with IFMSA. But it simply means that the criteria of a program coordinator are slightly different, and maybe you would have to enroll it again differently. So please do go through the suggestions or the corrections that are given to you by the program coordinator, and re-enroll if they suit you. These corrections may be guided to you either by mail or by a Google document or on WhatsApp or through a webinar or through an OLM. A lot of our program coordinators are doing it in very different ways, but you can definitely suggest a mode of communication that you are very comfortable with. Lastly, what do you do if after your enrollment is done, and what if you have certain changes in your activity after you have enrolled your process? It's very simple. In case you have a collaboration, or in case you have external funding, in case you have a change in methodologies, ensure that you're contacting your program coordinator immediately by mail or by WhatsApp. I definitely suggest you to contact them by mail. Let them know about the changes in your activity or in your project design. In case you are getting funding or in case you're getting a collaboration, like Natella mentioned, we have an ethical funding database. So in case your external is not in alignment with the ethical values of IFMSA, we may have to cancel your enrollment. But in case most of the times it's the case where our collaborators are very, very good and they have a very positive impact on our activities, we definitely welcome it very positively. And the only thing is we expect you to re-enroll your activities. Again, you have everything prepared, you just copy it. Additionally, you may ask your program coordinator in case you are asked to re-enroll your activity at any point for any reason, with suggestions, in case of re-enrollment with changes or any of those cases. You may ask your program coordinator to send you your previous answers in case you do not receive it on your Google, so that they could help you and you do not have to copy paste it again. This was a hack. Again, and lastly, who do you contact? You may contact the program coordinator you think your activity fits perfectly to, or you can simply contact me on ga.program@ifmsa.org to understand which focus area does your activity fit under, and I could contact you, or I could connect you with the next program coordinator that your activity aligns with. Additionally, you could mail me for any other reason. You could also mail our program capacity building development assistant for any kind of workshops or any kind of capacity building ventures, and she would definitely help you with them as well. So with today, we end our discussion on activity management, on project development, and on enrollment. We really, really hope this helps you, this benefits you, and this probably helps us get better enrollments and you get more impactful activities. And could we go to the next slide, please? I think that's the end. Yes. So we are open to any questions if there are any. Taide, could you please let me know?
No, we don't have any questions.
Oh, perfect. That would be lovely. Additionally, we could answer to any of your questions that you need even at the end of this webinar. Like I mentioned, please mail any of us and we would be very, very happy to help. Along with that, don't forget to join us don't forget to join us for the whole programs week for our capacity building session on crisis management. Don't forget to register, and our session on evaluation and reporting as well, since activity management is extremely incomplete without both of them. So rock and roll to achieve our goal, and see you soon. Bye-bye, and thank you so much.